Okay, so we're looking at ligament tests, and we're going to start with MCL, medial collateral ligament. So we're clamping the leg in, hand under the knee, nice and supportive. We're going to begin with a tiny amount of flexion in the knee and apply some valgus force. Okay, so that's the mechanism of injury. If Flora was going to damage her MCL, the force would have come in from the outside, splitting those bones open, forcing that MCL into a forced stretch or a sprain. Okay, so we're replicating that. So we're trying to put a stretch on that. All I'm doing is holding this leg and putting some valgus force, which is, we'll explain valgus another time. Okay, we're pushing through. Any pain?
No.
Okay, we can slowly start to bend that knee, but what you'll find is the more flexed it is, the more you get hip internal rotation, and we're kind of done. Okay, so we'll work our way down, pushing, pushing, pushing. And what you need to look out for here is if she says, yes, there's pain, you need to ask where that pain came from, because it could be from you pushing in onto the lateral side, or it could be from us forcing that joint space open. Okay, so that's MCL. LCL, slightly different, but the same concept. We're trying to put some force through the medial side. We're trying to get the tibia and the femur to come open laterally and put some pressure on that LCL. So what we're going to do there is hand on the inside of the knee, other hand just underneath the heel, keeping that steady with the right hand, and then putting some varus force through the medial knee. If you can't see, get yourself in a position where you can. Okay, so this is a very common one for people to say, yes, there's pain there, and if you don't ask the question of where is that pain, you might get caught out. Because you're expecting pain here on the lateral side to test for LCL, but they might actually say, no, they're getting pain here immediately. So that will be something else. Okay? You can test MCL like that as well. I just prefer this one. Okay, so to recap, nice and relaxed for me. MCL, you can see we're putting the force through that way, testing that ligament and the job it's designed to do, and then LCL, force through in the medial aspect. All right. ACL, we've got a draw test. So one of the things that the ACL does is prevents anterior translation of the tibia on the femur. Okay, so it keeps it there. If the ACL is ruptured, this tibia is going to move forward. What they call it the ACL draw test is because it comes out of a draw. So we're going to palpate the tibial tuberosity with your thumbs, hands around the back of the calf, and then put some body weight into it. You can actually pull this a decent amount. Feel all right?
Yeah.
Okay. And what we're looking for there, my thumbs are on the tibial tuberosity. You'll see those thumbs move towards you, independent of the patella, if there is any movement in that. And always test the asymptomatic side first, because some people will be truly hypermobile and they'll have more movement than other people. Ruptured. It's gone. And the reason that's important is because you can put them in that position, pull the leg forward, see the movement and think, oh, ACL. But it's already started off in a posterior position. So it might be the PCL that's gone and you're just bringing it back to neutral.
Would you get draw even with a partial tear? Or
You can. You can get some laxity, yeah.
Okay.
And usually pain if it's a partial, if it's like a sprain, grade 2 sprain. But if it's a full rupture, there might be no pain at all because there's nothing there doing anymore.
Yeah.
Okay, so that's ACL, PCL. And then finally, last one that we're going to look at is the meniscus. So this is a test called the McMurray's test. I use this a lot. What we're trying to do is to get those tibial and femoral condyles to clash medially and then laterally. Okay, so they're going to pinch that meniscus in as many different positions as possible, and we're going to assess for pain. And if there is pain, then we're thinking there's some damage to the meniscus. So what we're going to do here, palpation skills need to be on point. We're going to palpate that tibial plateau. Okay, so that's the top of the tibia and the bottom of the femur. All right, so have a little feel around. We'll take some practice. Get your finger and thumb in there, and sometimes that can be enough to trigger that pain anyway, especially medially. More common to tear a meniscus on the medial aspect. And if you're not sure if you're there, just give a little bit of rotation from the tibia, and you'll feel the tibia rotating against your finger, but the femur staying static. Okay, so practice that and do take some time because that can take a little while to find that quite quickly. So McMurray's, what we're going to do is a combination of flexion. Are you all right? That's a good one. Flexion, extension, okay, in that sort of range, and also rotation. So we're testing in small circles initially. So I'm rotating and flexing, extending. It's like drawing nice big circles. And then I'm going to slowly go deeper into flexion And what you're doing there is just getting those, I can feel the condyles getting closer together here, and then closer together laterally. Okay, and then if they're fine with that, deep, do I feel okay?
Yeah.
Deeper into flexion. Just play around in different